Magnesium helps the arteries to relax because the arteries are smooth muscle also. So you have skeletal muscle, obviously, that responds very well to calcium and magnesium. Calcium helps to contract your muscles, and magnesium helps to relax. Now, if you follow the lifestyle, you go to the gym and you eat healthy, and you also take some testosterone replacement therapy, then in many cases, your magnesium intake and requirement needs to go up. Moving over to bloodwork parameter management, lipid management. There are many over-the-counter supplements which help with lipids. Besides, healthy eating and doing daily fasted cardio or 10-minute walks in between meals, just staying active. Generally speaking, right, following a healthy lifestyle usually improves lipid parameters quite substantially. Beyond that, there's citrus bergamot or berberine or high-potency fish oil, even niacin, even though I'm not a really big fan because the effective form of niacin is the flush version. That's the one that brings your total cholesterol levels down, but that's also very unpleasant. I don't like beta-alanine and I don't like niacin, but there is some scientific evidence that shows that niacin can be very beneficial to lower total testosterone levels. Then there's ezetimibe. It's probably the best medication out there that can reduce low-density lipoprotein and total cholesterol levels. Ezetimibe works by blocking the absorption of dietary cholesterol and promotes the excretion of cholesterol within the liver. So, to keep it simple, long story short, testosterone instructs cells of the body to produce more cholesterol. Now, you can reduce a little bit of this cholesterol production by removing simple sugars, which have a similar effect, telling the body to produce more cholesterol. A primary production site of cholesterol is within the liver. So if you inhibit the absorption of cholesterol in the liver, then it doesn't go systemic, obviously. You can't detect it in total testosterone or LDL lipoproteins within the bloodstream. And if you promote the excretion, then you can literally get rid of this additional cholesterol that your liver synthesizes and is coming from the other tissues in the form of HDL. LDL transports cholesterol and triglycerides away from the liver in an attempt to bring that to other tissues. But if you're on testosterone and your other tissues are also producing cholesterol, then they might not accept this LDL. They want to get rid of this cholesterol through HDL, which transports cholesterol and triglycerides back to the liver. But if your liver is also full with the cholesterol, then it increases hepatic lipase, which breaks down HDL, and now you have more transport away and less transport to the liver. So ezetimibe can kind of offset this increase in cholesterol, and it's even been shown to, reverse various metabolic conditions in people who are otherwise unhealthy. There is some scientific evidence about ezetimibe that it lowers omega-3 fish oil absorption, but from all of the blood work that I've seen of people who are able to check their serum omega-3s before and after ezetimibe treatment, it doesn't appear to me that much of a substantial difference. And again, you can always take your ezetimibe in the morning and then supplement with fish oil multiple times per day later in the day when the ezetimibe is already gone systemic. So this is things you have to consider. But personally, from all the blood work that I've seen, I wouldn't worry about it too much. The benefits of ezetimibe far outweigh the potential negative side effects. There's reticulocyte, which is a natural lovostatin. It used to be very popular in the bodybuilding space, but many of us have made the switch to ezetimibe because unfortunately statins might cause myalgia, muscle soreness, or other problems. So it seems that the one that is the most favored and the most popular nowadays is rosuvastatin. Again, I would only use this if ezetimibe and the other health practices are insufficient to bring your lipids within normal parameters when you're running testosterone replacement therapy or before that point. And there's other statins and even PCSK9 inhibitors, which might be end-state lipid management. And I feel that in many cases, it's not required. But again, if it's required medically, then please discuss this with your primary healthcare provider. Blood pressure management. Again, balanced electrolyte intake. Magnesium helps the arteries to relax because the arteries are smooth muscle also. So you have skeletal muscle, obviously, that responds very well to calcium and magnesium. Calcium helps to contract your muscles and magnesium helps to relax. Now, if you follow the lifestyle, you go to the gym and you eat healthy and you also take some testosterone replacement therapy, then in many cases your magnesium intake and requirement needs to go up. And if you overlook that, or we're already magnesium deficient, it's actually one of the very common occurring deficiencies in the world. Vitamin D3 and magnesium deficiencies are very, very common. So if you start supplementing with magnesium and perhaps eat calcium-rich foods, I wouldn't supplement with calcium because it's too much calcium in your bloodstream in one go. But if you supplement with calcium-rich foods and take vitamin D3 and vitamin K to help bring that magnesium and calcium to the right places, over time, as your calcium and magnesium stores build up, you'll see that blood pressure management, it probably becomes an afterthought. And otherwise, right, there's over-the-counter supplements or ancillaries who can help with that. Still, I would look into calcium and magnesium first, right? There's magnesium citrate and bisglycinate and threonate, which can help with sleep quality. I would look there first because magnesium deficiency is so common that I would look there before applying any kinds of herbs or ancillary to keep your blood pressure under control. And again, if your body fat levels are high or you have chronic sleep apnea, address that also because magnesium might not be sufficient. There's carditone, a herbal formula, albeit that it's not clinically recognized. I've seen it reduce blood pressure in bodybuilders quite dramatically. There's tadalafil, Cialis. Of course, it was initially investigated as a blood pressure medication and then discontinued because of its long half-life. I believe it has a half-life of about 32, 36 hours, so it builds up over time. But the side effect of Cialis tadalafil is, high-quality erections. So I would take it for that and then enjoy the blood pressure management as a warm welcome side effect. Now, if you're going with Cialis, then it's very likely you don't need telmisartan. But if you feel that the blood pressure management of Cialis is not sufficient, again, as a side effect, you enjoy the libido, the erection quality increasing properties, you enjoy that, but you need more blood pressure management, then I would remove the tadalafil, the Cialis, and make a switch for telmisartan. Again, make sure you have an Omron blood pressure cuff, whether that's around the wrist or the arms, because telmisartan can drop blood pressure quite dramatically. I would start low after tracking your blood pressure for multiple days in duration. That's when you wake up, before you go to the gym, after you go to the gym, in the afternoon, which is generally when blood pressure levels are the highest, and then before bed. So you keep a blood pressure log, keep track of when it's high, when it's low, and maybe manipulate your diet slightly, increase your magnesium intake if needed. And then when you have firm grasp of how your blood pressure fluctuates, consider telmisartan. Right? And it's, again, something you have to discuss with your healthcare provider. You could start low and build your way up depending on how your blood pressure is under control. And if you don't respond well to telmisartan or you get adverse effects, which again, there are side effects associated with telmisartan, then look into other ACE inhibitors or ACE blockers to, get blood pressure management, but not have the side effects that you're getting from telmisartan. There's many ACE inhibitors, many ARB blockers, so please discuss it with your doctor because they probably know what is best for you. Then regarding estrogen management, besides the daily subcutaneous microadministrations and having low body fat, you can look into dinyl methane and calcium deglucarate. These are over-the-counter supplements that help with estrogen balance and estrogen excretion, metabolism. Dinyl methane is found in cruciferous vegetables, which helps with the balance between estrone and estradiol. When you take exogenous testosterone, it only converts into estradiol. When you take HCG, it mostly produces testosterone and then estradiol, but estrone to a certain extent. But you see, if you do your blood work, you check your total estrogens, your estrone, and your estradiol, that your estradiol is disproportionately high to your estrone. And so your estradiol comprises more of the total estrogens that you have. So this balance you can offset, bring that closer together with dinyl methane. Again, it's found in cruciferous vegetables. You would have to eat a boatload of broccoli and kale to the point you would have severe gastrointestinal upset. So go the supplemental route. When you start doing research, you will find that dinyl methane actually inhibits the androgen receptor, which is obviously not what we're after. It might downregulate the androgen receptor, but this is only studied in the context of prostate cancer, not in the context of skeletal muscle or androgen receptors in other tissues of the body where you would want to have positive effects. So I would say from all the research that I've done and the people that I've talked to using dinyl methane on hormone replacement therapy or full-blown steroid cycles, is that there's no adverse effect. Nobody notices that their anabolism or libido or overall productivity in the gym or quality of life goes down by adding in diethylmethane. And if you know that androgen receptors have a lot of genetic polymorphisms and variations between tissues, then you could understand that diethylmethane actually might be a good thing to take in case you have prostate cancer in your family, because it seems to only work on the prostate gland, right, in cases of prostate cancer. And with calcium D-glucarate, it does increase metabolism of steroidal hormones or neurosteroids. A lot of compounds in the body are glucuronidated. Some of this is recycled within the intestinal tract or within the body through glucuronidase enzyme activity, where it attaches glucuronidase and then metabolizes it off. And now this compound that you wanted to excrete through the kidneys is biologically active again. So by taking calcium D-glucarate, all the compounds that your body wants to excrete are glucuronidated and stay glucuronidated, marking them for excretion, because there's enough glucuronidase available for your body to excrete these compounds. And when we're talking about compounds, we're talking about estrogens, testosterone, many other toxins, and also some of the medications that you're taking. So again, discuss it with your primary healthcare provider. There's something to say for diethylmethane and calcium D-glucarate, but it also depends on what kind of other medications you're taking, which we're not discussing in this presentation. Otherwise, right, if the daily subcutaneous microadministrations are not working or reducing your body fat, or diethylmethane or calcium D-glucarate is not a route you want to go with, then exemestane or anastrozole are medical aromatase inhibitors that will inhibit the conversion of testosterone into estradiol. The downside of this is that exemestane and anastrozole reduce the conversion, right? The serum estradiol is now in range, but total testosterone might be higher. And in this difference in increased total testosterone, you might aromatize or 5-alpha reductase more into dihydrotestosterone. So estradiol goes down, but DHT might go up, and thus you increase the potential for hair loss. And it's the same way the other way around. If you notice that you get increased conversion of testosterone into dihydrotestosterone, I don't have a slide for this, but it just springs to mind. Your DHT levels are high, and you take a 5-alpha reductase inhibitor to bring that down. Now your estrogen goes high. So this is why it's so important to do blood work and assess what side effects you're suffering from, because from a cosmetic appearance, men usually experience 3 side effects. It's either hair loss, it's either gynecomastia, or acne. And maybe you get 2, right? Hair loss and gynecomastia, or hair loss and acne, or gynecomastia and acne. 2, if you get 3, then it's very unfortunate. I get acne, but no hair loss, and gynecomastia, which I would have to remove with surgery. So you have to be well ahead, do the blood work frequently, because if you let it run, right, you're taking an aromatase inhibitor and now your DHT levels are high, and then one day you wake up looking in the mirror and you're like, I almost look like Steve now. What the hell is going on? This is not what I wanted. Right? I prefer to be bald. I don't like hair, but some people really enjoy their hair. So this is something you need to be aware of. Aromatase inhibitors increase the potential for hair loss, and 5-alpha reductase inhibitors increase the potential for gynecomastia. Do your blood work, adjust frequency until you dial in your TRT.